I teach ultrasound to a very basic level in practices, and I teach them how to drive their own machines and how to get a standard view. And I go in and they've always got a list of questions. How do I find the adrenal gland? How do I find the pancreas?
Adrenals.
And my first answer is, we may get to that today, we may not. But what I want you to do is to be able to do an ultrasound machine in a systematic way, an ultrasound approach in a systematic way. Every time you do it this way, so you don't miss anything out, so you can see relations between organs. And it comes as a complete surprise to them when we've done that a few times. Oh, I didn't realise you could do it this way, and then you can actually see what the differences
Well,
are.
it is the most operator-dependent form of imaging, and it's well known for that. The other thing I think that what we focus on is how important it is to understand the controls and to drive that system. And we liken it when we do our teaching to driving a car. My son's just passed his driving test, but you wouldn't want to have gone in the car with him and him take you around the M25 if he'd never had any mentoring, never had any lessons, he'd never read the highway code, and he hadn't passed his test. But it's okay to drive an ultrasound machine because you know anatomy and you know some pathophysiology, and therefore if it's point and shoot, you should be able to ultrasound.
But that's not how it works. And I think if you think about it as well, in the human world, if we're just going to do general medical, which basically is scans, isn't it?
Kidneys and livers.
That's a year training. And would you be comfortable
just doing that?
So not doing obs and gynae, it's a year just doing gen med. And the way I try and explain to the people that come to us is, if you or anybody you loved was going to an NHS hospital and having an ultrasound scan, would you like to know that they are qualified, have been assessed, are competent, have spent a year learning their craft, and then they have a preceptorship period where they're mentored and protected, basically? Or are you all right if they've just done a half-day course where they might have spent, or even a full-day course, and they might have had 20 minutes holding that probe? What would you like? What would you be confident in? It isn't going to be the 20 minutes on a machine, for sure. Well, I would hope not.
No, and
what
there are some
happened to the vets.
Absolutely. You're quite right. And there are some things that you can do a half-day course for and be quite fine on picking up as a very quick exam. But I've seen an awful lot of misdiagnoses, which is a real worry, because it's so easy to do. There's no one to check whether they belong.
I think that's what I noticed at the referral centre, is we would have cases that came in that had been possibly scanned incorrectly, or they'd come to the wrong conclusion, or they'd gone to theatre and they hadn't found what they thought there was. So it all had to be done again. And the clients, they're saying, we've just had a scan. Why do we need to pay for another one? So it has all sorts of ramifications as well. And finance, we all have financial, implications in what we do. And I think what we're trying to instigate is that if you do ultrasound well and you become good at it, that is a skill that will help you to bring in revenue for your business, and it will mean that you have a safe and sustainable service. It's not just about finding the adrenal gland, it's about having a service that you can be proud of and that your clients will come back to you.
Yeah, and it's not just about the patients being safe. It's about you as a practitioner being safe. When you've done something, you want to go home at night and sleep, not be thinking, oh my God, was I right? Did I make that right call?